Hello friends, I am Dr. Prashant Sharma and you are watching MEDICO'S Hub. In this video, we are going to discuss the outline of immunity. First of all, what is immunity? Immunity is the ability of an organism to defend against the invading agent, which may be living or non-living. Immunity is classified into two categories. First one is innate. Second one is acquired immunity. Now, what is innate immunity in terms of presence of resistance to infection? It works since birth. So, it is present since birth. But the acquired immunity appears only after birth, and that also after the exposure of antigens. Now, immune response develops. Innate immunity starts working within minutes, but the acquired immunity takes days to initiate the work. Prior exposure to antigens, it is not required in case of innate immunity, but it is a prerequisite in case of acquired immunity. That is, prior exposure of antigen is required. Now, diversity, it is limited, that it covers the limited number of antigens, but in case of acquired immunity, it is varied. It covers a number of antigens. Immunological memory is absent in case of innate immunity, but it is present in acquired immunity, that is, the memory cells are formed in acquired immunity. Now, what is the response? Innate immunity responds to microbial antigens common to many microbes. These are known as MAMP, that is, microbe associated molecular patterns. While acquired immunity responds to specific microbial antigens. Now, host cell receptors. Host cell receptors are non-specific type, like toll-like receptors. For example, toll-like receptor 2, it binds with bacterial peptidoglycan, while toll-like receptor 3 binds with double-stranded RNA of viruses. While here the host cell receptors are very specific, that include B cell receptor and T cell receptors. What are the various components of innate immunity? These include mechanical and chemical defense. These include the activity of NK cells. We can see here NK cell, non-specific cells, inflammation and fever, then complementary system, acute phase proteins like C-reactive protein and interferons. It's important to note that complementary system works via 3 pathways, out of which alternative pathway and mannose binding pathway are components of innate immunity, while the classical pathway comes in acquired immunity. Now, the components of acquired immunity are lymphoid organs, which are classified in primary and secondary. Primary include bone marrow and thymus, and the rest like lymph nodes, spleen, Waldear's ring, tonsils, etc. all are included in secondary lymphoid organs. Then lymphoid cells. These include T cells and B cells. And the complementary system. Complement system, classical pathway only. So these are the various points of difference between innate immunity and acquired immunity. In next video, we'll discuss innate immunity. There will be a series of videos on innate immunity. Thanks for watching this video. Hit the like button, share and subscribe our channel to get the latest updates and notifications.